Hello and welcome to the She Found Motherhood podcast. Today we are so excited to be talking to Renee from the Mom Room, all about her birth story and experience and what she learned from it. One of the biggest take homes I got from this is how what seems so important to us leading up to an event with our expectations and our anticipation is not necessarily what you remember or what ends up being really important. So really keeping a good perspective on the big picture is so important. Renee talks us through her delivery, what she learned from it, what she wishes she knew before, and how that changed her trajectory in life in terms of her working plans. Today's episode is sponsored by shefoundhealth.ca. We have an amazing online prenatal course that we take you from preparing for delivery all the way through the first few weeks of postpartum. We cover everything, all of the stuff you want to know and all of the stuff that it's really important that we think you need to know. We're two experts in maternity care and we have been through it all and seen it all. So if you need an online prenatal course that you can watch when you want, where you want, and covers it all, check it out at our website, www.shefoundhealth.ca. Welcome to the She Found Motherhood podcast, where our goal is to support you in the journey from pregnancy through to parenthood. We are so passionate about this time in a woman's life, and we want to make sure you have fun and reliable information you can trust. She Found Motherhood podcast is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This does not apply to every situation. If you have questions or if you have received different advice, please contact your healthcare provider. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Well, hello, Renee. Thank you so much for joining us on the She Found Motherhood podcast. Why don't we get started by you just telling us a little bit about yourself?
Sure. Well, Alicia, thank you for having me. Super excited to chat with you. I'll give you kind of like the Coles Notes version because a lot of people see me on social media and they're kind of shocked to find out some things in my past. So I'm from Northern Ontario, which people find shocking. I don't know why. A lot of people think I'm American for some reason on TikTok. I don't know why. But yeah, Northern Ontario, from Sudbury, and my whole life I would describe myself as an athlete, which also I think surprises people because I have a PhD. So yeah, I played volleyball my whole life until university. So something that people don't know is that I played Division I volleyball in the NCAA, which is like so random now that I think back about it. It was so long ago, but I did that for a year and I hated it. And then when I came back home, I went to school in my hometown in Sudbury and they didn't have a volleyball team at the university. So I just decided like, okay, I'm not going to play anymore and I'm going to focus on school, which I had never really done before. So in university, I became a huge nerd and like super focused on school. And I realized that I loved university. So I stayed in it for as long as possible. And I did my master's and then I did my PhD. And then in my PhD program, which I did my grad school in Ottawa, so left Northern Ontario. And then in my PhD program is when my fiance at the time and I got pregnant. And I had Milo and took a 12-month maternity leave. And then once I was nearing the end of the maternity leave, I only had a little bit of my PhD left to do. I had to finish up the final draft of my dissertation and then do the oral defense. And I was like, I need to start something that is like related to being a mom, because once I had Milo, I felt like I was going through all these things like postpartum recovery and not wanting visitors after giving birth and just these things that I didn't expect at all. And I was like, I need to write about this and get it out there. So then I started my blog and then I had changed my Instagram account to the Mom Room. And I was like, I'm going to change all my social media stuff to, to be mom related. And yeah, it just got such positive feedback every time I would post a blog about these different topics that people don't talk about, then I got into TikTok, and then that blew up, and then I started the podcast. And so, yeah, it's just kind of snowballed into the mom room, and, this place where I talk about things that people don't really talk about, and try as best as I can to share other people's experiences as well, because it's just so valuable to hear what other people are going through, and then knowing that you're not alone. So yeah, that's a little bit about me. And I did finish my PhD right before quarantine started. So that's done, and now I'm just doing the mom room stuff.
Awesome. Yeah, it sounds like you've had a bit of a change in trajectory after becoming a
Yes.
parent, which is part of why we started doing these birth story podcasts, is because it changes you. I mean, like it or not, it does. And so a lot of people don't anticipate that, I guess. And it's okay
Yeah.
to shift your focus and your perspective, right? As
Yeah.
life changes and the seasons change. So yeah,
Yeah. And
awesome.
people always say like, oh, everyone is, when they find out that I have a PhD, I think people are so concerned about if I'm going to use my PhD. And it's like, yeah, I'm using it right now. Like I'm a speaker. I'm a writer. I can research things like nobody else can research things. Like I am using it. I'm not using it in the traditional sense, but without all that experience in grad school, I wouldn't be able to do what I'm doing today. So yeah, I like to make that clear as well.
And things have shifted so much, especially with COVID, but even before with social media. Like people are getting 40% of their health information through social media these days. And so it's really
Crazy.
important for people to have reliable sources and reasonable support systems. And that's what you're providing on the Mom Room. And that's what we're trying to do with She Found Motherhood as well, is provide reasonable, high quality, evidence-based information out there, because there's a lot of misinformation out there as well. So
Mm-hmm.
cool. But today we're going to talk about a little bit about your journey into motherhood, parenthood.
Yes.
So tell us about kind of your pregnancy and how that went and how getting pregnant went and all whatever you're comfortable sharing.
Yeah. So it's funny, when I was looking at the points for this conversation and I saw pregnancy, like, how my pregnancy was. And I thought, oh, my pregnancy was amazing. Like, I know a lot of people have a different experience, and sometimes people don't enjoy being pregnant, but I had zero issues. And then I saw that you had put fertility there as well. And I had totally, it's almost like I forgot that we had tried to get pregnant for years and it just didn't happen. Like, we would go through phases of like really trying and then kind of like getting over it and then really trying. But yeah, we went through all the fertility testing. And so this all the testing happened when we lived in Sudbury for 2 years, just recently, like before, like what Milo was born in Sudbury. So my husband was working there for about 2 years, and that's where we did all our fertility testing, which all came back normal. Which is, it's almost like you want to find something because it's like, then maybe you can fix it, right? But yeah, everything came back normal. So their suggestion was to try IUI first. So being in Sudbury, which I don't think a lot of people realize, there's zero fertility support in Northern Ontario. So you have to go to Toronto, which is a 4-hour drive. So we thought, okay, we'll try the IUI. So they had booked us, referred us out to a clinic in Toronto, and then the day, like weeks later, we got the email for our appointment in Toronto to do the IUI. And that is the morning that I found out that I was pregnant. Like, so bizarre. So that was in early January. And then, yeah, Milo was born in September. So that's how our fertility journey went. And then, yeah, pregnancy, I really enjoyed being pregnant. I think part of it is also that I'm 6 feet tall and I just have a lot of room for a baby to grow. So I didn't feel like it was taking over my body, like I had a small bump like the whole time. I only had 24 or 48 hours of intense sickness to the point where we almost went to the hospital because I couldn't even keep water down. So I was like, sucking on the electrolyte drinks, like just trying to get through. And then eventually that passed. Um, and yeah, I was induced at 38 weeks, which some people don't enjoy that process, but I loved it. I think being a type A personality. So yeah, pregnancy was good for me.
Why were you induced, may I ask?
So Milo, he they noticed that he was small in ultrasounds, and then how they described it to me was almost like he had plateaued. And so during my pregnancy, I was getting more regular ultrasounds than somebody else might have, because they were monitoring his growth. And so basically my placenta just stopped kind of giving him what he needed to grow any bigger. So her thinking was, let's get him out as soon as possible so that you can feed him on the outside of, your uterus instead. So, yeah, so that's why they induced me.
How did you feel when you were told that that was the plan, or when that discussion was happening? Was that like challenging for you? Did you always imagine that you were going to have kind of a quote unquote natural delivery, or was there a big shift in focus, or were you like, okay, sure?
Yeah, no, I think my entire pregnancy and even since Milo was born, I've just kind of been like, go with the flow and try not to have expectations, which I think people get hung up on these expectations of what their labor and their delivery and what the newborn phase is going to be. And then when it's not that, you are upset about it. So I tried not to have expectations, and I kind of liked the idea of knowing exactly when it was going to happen, and especially with my husband's work, because then he was able, because I was going to be induced on a Friday and he was on call that weekend. So he was able to switch around his work schedule, which was nice as well. So yeah, I was okay with having everything planned out.
Awesome. How did you prepare for kind of labor? How did you learn? Like, did you do any courses or read books or Google stuff, talk to friends? How did you kind of prepare, or did you at all?
Yes, I did. I am like an over preparer to the max. So I read books. One book that I'll send you the information on it. I can't remember the author, but you've probably heard of it. It's called The Birth Partner. It's a
I
really
haven't.
good book. Oh, it's so good. Explains like every detail of what's happening, in early labor, active labor, and what you can expect basically. So yeah, I read a bunch of books. I went to like a prenatal course. My husband and I went. It was put on by a doula that was from Sudbury. I did like a course with a lactation consultant, read breastfeeding books. I did prenatal yoga. I did yoga throughout my entire pregnancy. Um, Pelvic floor physio, like you name it, like I'm gonna do it. um,
Nice.
yeah, I had a whole I actually met with a doula because my initial plan was to have the doula at my birth with me, but the rules in Sudbury are that you're only allowed to have two extra people in the delivery room, and I wanted my husband and my sister. So I ended up not having the doula there, but I did work with her before going into labor or before being induced, and we worked out a whole like birth preferences, and she explained like all my options to me, which was really helpful. So yeah, I was super prepared.
I love that you said birth preferences, because we use that term too, because having a birth plan means that you have something that you are fixated on. But birth preferences is all about when would you accept a certain thing? What are the conditions under which? And so I think it totally prepares you more for the possibilities, and also being, like you said, go with the flow, open to what you and your baby need to keep you healthy while having what you hope, dream, aspire to happen. And we certainly have a birth preferences sheet, so I'll link that in the show notes below if anyone's interested in it. But it's so such an important distinction and
Yes.
separation there.
Yeah.
Cool. So how did the delivery go?
So I had to think about this today. I went in, I remember going in the morning. I had I have a blog that I wrote about like what I packed for the hospital visit. It's unbelievable. Like I had like everything you can imagine because I just wanted to be comfortable and have everything that I would use at home. But yeah, we got into the room. I had a ton of snacks and like everyone was in a good mood. I was there with my husband and my sister. My sister's a nurse, which was helpful. My husband's a physician, so that was also helpful. And I can't leave him out. But yeah, I remember they broke my water. That was the first thing they did was break my water. Although like previously they had done the sweeps. What's it called?
Cervical sweeps or membrane sweeps or stretch
Yeah,
and sweeps. So
stretch
many
and
names.
sweep.
Yeah.
Yes. So super painful, like unbelievable, but very quick. It just kind of like jolts you. And so I had those done before and I was a little bit, I think I was 2 centimeters dilated. And I remember, I think they did you put the night before you're going to be induced, they put the Cervidil or the gel on to, I guess, promote dilation or get your cervix ready, ripened, whatever they call it. And so the next morning I went in, 11 a.m. they broke my water, which was not painful at all. You don't feel anything. And I just remember like a bunch of fluid gushing out. And then I was laying down for a while. And when I stood up to go pee, more fluid just like gushed all over the floor. And it was hilarious. Like we were dying laughing. I specifically remember that. And then I think they started Pitocin for me at 2 p.m. And then I started to get contractions at 3:30 around there, like that were pretty painful. And I remember my sister like coming over to the bedside to see how I was doing. And I remember asking her, like almost in tears, like crying because it was so painful, like how much longer do I have to do this, like before I can get the epidural? And so she was like, oh, like she realized that I was in a lot of pain. And then she asked one of the nurses and they were like, oh, she could have the epidural anytime. And I was like, are you kidding me? Like, so my sister told them that I would like the epidural. And so the anesthesiologist at the hospital was busy at that time, but they did have a resident. And my husband, being a physician, was like, we're going to wait for the staff anesthesiologist. And I was like, are you kidding? Like, do we have to? And he was like, yes, like we're going to wait for the staff. So we waited. And I think she came up and did the epidural at 4:30. And I have to say the epidural for me was the scariest, like most anxiety producing part of the whole experience. And I don't know why. For some reason, like you're sitting up in the bed. I had my hands on my husband's shoulders. And I just remember shaking, like uncontrollably shaking. And at the same time, you're still having your contractions. So it's scary to think that they're like putting this needle in your back to freeze your body basically. And so, yeah, I just remember shaking and being so scared of that part. But once that was over, it was fine. And then the epidural for me worked amazing. And then from there, I think I started pushing around 7 p.m. or quarter after 7. Which to me was like, years ago, I used to do CrossFit classes, and that's literally what it reminded me of, because every time they would tell me to push, I like gave it everything I could, like so hard. And then if he didn't come out after that push, I was like, fuck, like I was so hard on myself, and the nurses were laughing and they were like, it's okay, you're doing great, like he's not going to come out after one push. But and so yeah, my sister always says that I was like the LeBron James of giving birth, like pushing. So I think I pushed for 45 minutes and then he came out, but he did have my OBGYN notice that the cord was not like all the way around his neck, but it was on his neck somewhat. So I remember near the end, right before he came out, they called the NICU team up to the room to wait for him to be delivered. So yeah, the NICU team had to come up to our room and wait for him to be delivered so that they could check that everything was okay after he came out. And luckily, like them checking him and giving him the okay it didn't take very long. But I remember that being really scary, thinking like what is going on? Like, you know, you're so focused on pushing and getting him out, and then just, you know, in the back of your head you hear them like, oh, we have to call the NICU team, and like you hear things going on behind the scenes, and then you start to panic, like, oh no, like what is happening? But that didn't last long, and then like within minutes he was like in my arms and everything was fine. But yeah, one thing my husband never lets me forget about delivering is that when, like, one of the first times that I pushed, I peed on the doctor.
Means you're pushing well.
I know. I was like, well, what do you expect? Like,
What do you expect from LeBron, right?
yeah. Yeah. So that was my experience with giving birth.
How did things go after you had Milo in your arms? How did things go? Like any troubles with kind of placenta or bleeding, or kind of how did the stay in the hospital go?
Yeah. So everyone talks about delivering the placenta and also the checks that they do, like by pressing on your stomach, and how painful that is. And I have zero recollection of any of that. I don't even remember delivering the placenta, but my sister saw it and she told me because she thought it was cool. And, you know, and then my OBGYN pointed out to my sister, because Milo was plateaued in the womb and wasn't growing, and they suspected something was wrong with my placenta. I remember my sister telling me that my doctor pointed out to her like what was different about my placenta and why that may have been happening. And so I know I delivered the placenta, but I don't remember doing it. And yeah, the pressing on the stomach, I don't remember. We were really good with breastfeeding, like instantly. I I didn't breastfeed for very long. I pumped for like 2 months and it was a whole thing. I have a podcast episode all about my experience with breastfeeding and formula feeding. But yeah, breastfeeding was not an issue at all. Like Milo latched instantly. It wasn't painful for me. Like I never had bleeding nipples, like nothing like that. One thing that is hilarious about our hospital stay, we had a private room, and it was good timing because he was born at 8 p.m. So it was a nice transition to like, okay, he was born, we were up for a few hours, and then it was bedtime, which was nice. So we weren't up all night, you know, for a few nights in the hospital. But I remember the nurse came in the morning, the day after he was born, and she was like, "Oh, is everything going well in here? Like it's been so quiet." And I was like, "Oh yeah, like Milo slept through the night." And and she was like, you have to wake up your baby to feed him." Don't worry everybody, Milo's fine. But I was just like, oh my God, really? Like, this is my first night as a mom. And my husband's a doctor. I have a PhD. They were probably like, oh, we'll just leave them. They're fine. And Milo slept through the night. But you know what? Looking back, I'm like, we had a full night's sleep and everyone was fine. You know, we woke him up and we breastfed him in the morning. But yeah, that was just like a hilarious story that I'll never forget.
Those babies are usually pretty sleepy the first night after delivery, but it lulls new parents into this sense of like, oh, I have this unicorn baby who slept the whole night or was like super
Yeah.
great. And then the next night, oftentimes they wake up.
Yeah,
But
exactly.
so when you went home, how did things go? Because I know you talk about kind of visitors and kind of recovery, and you didn't feel prepared for that. So how did everything go when you went home?
Yeah, so we ended up the next day after he was born cuz we had to stay in the hospital for 24 hours. So we were discharged from the hospital around 8 p.m. the next day. So we went home. My mom had made like a big like stew or chili or something in the crock pot, and I remember thinking like, "Oh, I'm going to have a beer." And I took like two sips of the beer and I was not interested at all. Um but yeah, the first I remember thinking like how are like does everybody feel this way like with regard to physical pain in your vaginal area? You know, it was hard, so hard just to walk around, to like scooch on the couch, like to reach for Milo or to reach for something. Like everything was such a struggle. It was like 10-minute production to go to the bathroom just to go pee. Like the diapers, the pads, the like it was brutal. And the thing that nobody talks about, a lot of people talk about bleeding, which I think is expected, but nobody talks about the swelling. Like I was so swollen. Like I told you, I was pushing like CrossFit style pushes, and so that results in insane swelling. Um so yeah, one thing I didn't expect, which is it's hilarious now that I think back on it, but a week after having Milo, I developed like a welt on like in between like my vagina and my bum, but like on the skin, like on like the lower part of my butt cheek, let's say. So like I was starting to heal, and then I developed this welt. And so at one of Milo's visits to our family doctor, I told her about it and she looked at it and she was like, "Yeah, you should probably go to the hospital and they can drain it like a general surgeon." I was like, "Are you shitting me right now? Like, I just gave birth and now I have to go to the hospital to like so that they can cut up my butt cheek? Like, this is horrible." So I went to the hospital, and of course, my husband knew, like, the nurses and the general surgeon that I saw knew my husband. So I was like, "Oh, this is fun." And I just remember them saying, like, "Oh my God, you poor thing. Like, you just gave birth and now you're back here, like, with this welt." So they drained that, and thank God it wasn't bad enough to where I had to have home care come and like pack it and, do that stuff. Like, that would have been awful. But one positive that came out of that was that they froze me to do like to drain it and to cut it. And so I remember driving home from that appointment being like, wow, I feel amazing. Like, cause my whole area was now frozen. So it was comfortable to sit. But then once that wore off, I had, like postpartum vagina injuries, and then I had this cut open welt on my butt. So that sucked. But yeah, with regard to not wanting visitors, I wasn't expecting that at all. And I've never before heard someone say that when they brought their baby home, they didn't want visitors. And so I was like, what? Like, am I the only one that felt this way? But for a few weeks, I didn't want anybody except for like my mom, my sister, my dad. Um, so yeah, that was luckily for me, like my mom, I call her like the gatekeeper. Like she was the one that was dealing with family, and like I'm super close to my family. Like I think people assume that, they hear me say that and they think, oh, like she must not have a relationship with her family. But no, like we're super close. And I just wanted to be alone with Milo. And, unless it was my mom coming over and helping cook things and wash things and prepare things, and I'm super comfortable like just pumping in front of her and breastfeeding, and it was no big deal if I could just go to my room and take a nap and she would hold Milo. Like there's a different level of visitors, you know? So yeah, I didn't have visitors for a long time.
Yeah, and that's one of the things we talk a lot about in our prenatal courses, kind of like figuring out who your supports are in the different respects, like your physical supports. So cooking for you, tidying your house, your emotional supports, like your best friend, your partner, whomever that is, and asking them before for specific help and having one person as the gatekeeper, because it's so true. You're like, it's this huge transition, right? They call it matrescence. I don't know if you've heard that term, like the
No.
transition from being a woman to being a mother and all of the hormones that go through it. Like it's this, like, it's like adolescence, like matrescence,
Yes.
huge transition, right? And your body's not yours anymore and you're leaking from every orifice, and it's just, and you're trying to figure out what to do with this baby and you have no idea, and breastfeeding, and you just need to be able to be as a dyad or a family unit for a little bit to figure that all out, right? And it's good to
Yes.
have people who are supportive and useful, and you can do whatever and say whatever and it's okay, right? Like you're safe people. But over and above that, it's a lot of pressure that you have to, put clothes on when people come over, or maybe
Yeah.
wash your hair, or I don't know,
Like the worst.
right?
Yes.
It's interesting with COVID, we've noticed that breastfeeding rates have gone up dramatically because we don't have all of these
Oh,
people coming into the hospital visiting. And so people can just be with their tops off with their babies, skin to skin. And so actually there's been a dramatic improvement in breastfeeding rates through
like
COVID.
that's so interesting.
Yeah. Yeah. So if you were to look back on your experience, is there something that you wish you had known more about or you had prepared more for? It sounds like you did lactation courses, like it sounds like you actually did a lot of kind of preparation, but is there anything looking back that you wish somebody had told you or warned you about, or that you had prepared for more effectively?
You know, I always stress the importance of pelvic floor physio, and I just randomly ended up at a pelvic floor physio, and it's crazy because my husband's a urologist and he is the one that often refers people to a pelvic floor physio, but I just happened to go to one because my friend worked with one, and I thought it was so interesting. Um, so that, like, I would tell people that, but for what I would do, I would say I wish I knew more, like, kind of told myself not to stress about certain things. Like, I think you have these ideals when you're pregnant in how things are going to go. Like the breastfeeding, for example. Like, I I was really good at, and my husband as well, really good at not putting pressure on myself to like to do certain things like the sleep training or the breastfeeding, or if things weren't working out for whatever reason and there was another option that was working amazing for us and it made all of us happier and our family function better, then just do that. And I think it took a while for me to like accept, like, okay, we're just going to do formula with Milo. And I pumped like day and night for 2 months and froze breast milk because I had it in the back of my head like he is going to drink this breast milk at some point in his life. And so then every once in a while I would try and reintroduce it to him, and then same thing, up all night, crying, irritable, diarrhea. And I was like, finally my husband was like, he does so well on formula, why are we stressing about this? And so it took a while and like convincing to get over that. And then the same with the sleep training. I found myself wanting to sleep train because that's what people do. And you hear other people's kids are sleeping through the night when they're 4 months old. And so I wanted that for us as well, but I wasn't comfortable doing it. And so, we tried a couple times and I would sit in our bedroom and just cry. And my husband was like, okay, so why are we doing this? Like, if you're not comfortable, I don't like listening to him cry either. So let's just go get him. Like, and we just decided from then on, like, okay, we are not doing sleep training. Like that is it. And so it was nice to have someone to just like confirm those things, because I think as a mom, I struggled with like, no, he's going to have the breast milk, or like, oh, we're going to do the sleep training, we're going to do it and it'll be fine. But it's nice to have someone there being like, if you're not comfortable with this, it's not working for us, almost like validating how you feel and being like, it's okay to not do that. So yeah, I guess just knowing not to put pressure on myself for certain things that society puts pressure on us for.
Yeah, awesome. And I think that's really good advice. What your family does is going to be different than somebody else's family. And as long as everybody is safe and comfortable and happy with that, that's just fine. Right.
Yeah.
And I think we have so much pressure from, social media is a huge one.
Yeah.
And, societal expectations, but it's not always applicable to your family, and that's okay. And
Yeah.
just coming to that realization is a struggle for a lot of families, but hopefully they get there sooner rather than later, and then they feel comfortable with their decision. So yeah, I think
Yeah.
that's great advice. And so my last question, and you kind of talked about this before, is how has having Milo changed your trajectory in whatever way? Like, did you have plans of what you were going to do before Milo, and those just kind of 180'd or shifted dramatically?
You know what? My plan was always like when you're in grad school, you're so focused on yourself, and everything was about like reaching the next goal. It was like, okay, I'm going to get this scholarship. I'm going to get this like conference in wherever. I'm going to get this. I'm going to get this funding. I'm going to publish this study. It was so focused on myself. So the biggest change for me after Milo came into the world was that I couldn't focus so much on myself anymore and only like trying to reach my goals and not worry about anything else. Like now it's like I had a whole other like part of my like part that was added to my life. But I will say not only is it Milo that has kind of changed my trajectory, because initially I was like, I'm going to be a professor, like a psychology professor, or I'm going to start some like research program somewhere out of some hospital. But to do that, I would have to be really flexible and just be willing to up and move to wherever that position was, which, now with my husband and his career, I can't do that. So I've kind of just like adapted to being with my husband and then now having Milo. And it's just kind of like, okay, I'm changing my path. My husband can't really change his path, unfortunately. I think my schooling is I can generalize it to other things, whereas he can't. Like, he is a urologist and that's all he can do. And we kind of have to just go wherever he starts his practice. So, and now with Milo, given that we're on the outskirts of Toronto, it's not feasible and it doesn't make sense for me to commute into the city for a job downtown because that's where all the jobs are. But it doesn't work for our family. So I'm going to write a book. I'm going to start a podcast. I'm going to like do other stuff that I enjoy doing. So yeah, it's been like Milo has changed my career path, but so has my husband and our family. It's like we're just making decisions for our family, which I think a lot of people don't understand that. Like I said, people are always like, oh, you're not going to use your PhD, or oh, your son goes to daycare and you're not, working some 9 to 5 job downtown. Like, how can you send your son to daycare? Well, this is what works for our family. Like, I'm doing other things that I'm passionate about that are like productive, and this is what works for us. So, yeah.
And I think you're helping a lot of people, women, mothers,
Thanks.
specifically normalizing what it is, right? Because it's not all
Yeah.
easy. It's not all sunshine and roses. And I think there's a huge amount of guilt out there about your experience not being the same as what we see in social media and on society. And so by normalizing that, you're actually really supporting women in being who they are and who they want to be. And I think that's such a valuable thing that you're doing with the Mom Room. So thank you for
Oh,
doing that.
thanks. Thank you.
Awesome. Well, thank you so much for coming. We will link to a couple of those podcasts and the book that you loved in the show notes so that people can check those out. And
Perfect.
yeah, I'm super excited to have chatted with you.
Yes, thank you so much for having me.
If you enjoyed listening, please head over to iTunes, subscribe so you don't miss any new episodes, and please leave us a review. If you found this helpful, take a screenshot and share on social to help other mamas access this information.
Check out our website at www.shefoundhealth.ca and join our community. We send out weekly emails and release new content focused on this incredible time in your lives. We'll also be sharing exclusive offers, so be sure not to miss out.